So we are talking about dermis. In the dermis, we talked about two things, that is hair follicles and nerve follicles. Now we will talk about receptors. What are the receptors are present below the dermis? We have to know, because everything is related to the receptors only. Okay, whatever we sense, whatever the environmental changes occurs, how our body identified, okay, those things. So we have to know receptors are very very important, and as well as we have the glands below the epidermis, which we have to know. Okay, now we will talk about receptors. Most sensory receptors for the cutaneous sense are found in the dermis. Merkel cells are in the stratum germinativum, as are some nerve endings. The cutaneous sense are touch, pressure, heat, cold, and pain. For each sensation, there is a specific type of receptors which is structured that will detect a particular change. For pain, heat, and cold, the receptors free nerve endings. For touch and pressure, the receptors are called encapsulated nerve endings, which means there is circular structure around the sensory nerve ending. Okay, so basically we have receptors which take the signal from the outside environment to the inside environment. Okay, so basically we have the skin here. Okay, what do we have? We have skin here. This is the skin. This is the epidermis and dermis. Okay, one fly came here and it will sat on your epidermis area. So then you realize that the fly is sitting here. Then he started biting you. So suddenly your another hand will work and it will kill, or it will bite it. Okay, it will bite it. So why this happen? Because we have receptors, sensory receptors. Sense means whatever sensing you hear, it will take the sense first, sensory motors. So whatever the sense is taking from this outside environment to the inside environment by sensory motors, means these nerves are called sensory nerves, which take the sense from outside environment to the inside environment. It will attach to our spinal cord. Okay, whatever wherever it have, it will attach to the spinal cord, and spinal cord is attached to our brain. In the brain we have the area where we see the, we will have the sense. Okay, why this is happening? Because here in the epidermis we have Merkel cells. These are the called Merkel cells. Okay, but the Merkel cells are also two types. Okay, we have senses like touch. First the fly sat here, which is the touch. Then the pressure, it will, it will sat very heavy kind of fly, will will have pressure. Then we have heat. Okay, whenever you put your hand on in the hot water, you will feel hotness, heat, heat, heatness. Okay, cold, whenever you touch the cold drink, you will feel coldness. And pain, if this fly will bite you, you will feel pain. Okay, why this is happening? Because we have sense receptors will taking the sensation from outer environments and receive, giving to the inside environment. Okay, inside environment. So basically we have to remember that we have five types of senses: touch, pressure, heat, cold, and pain. So whenever a paralytic patient came to your clinic, so you have to ask these five questions, because if he unable to sense or not, his sensory nerves are working or not. Okay, you have to ask touching. you are giving the pressure, you have to apply the heat also, sometimes cold also, you have to give pinching also. Okay, you have to remember, please. Yeah. And the second thing we have to remember that that this receptors which sense pain, heat, and cold are called free nerve endings, because these are the things which are very, very important to our body. It will help damage our body. So there's the reason pain, heat, and cold are taken by free ending nerves. They doesn't have any type of shape. Okay, I think here we have the diagram. Let's see. Here we have the diagram that Mark cells, Michael cells. Okay, means if it is a nerve ending, this is the nerve ending. These are the receptor Merkel cells will attach to the free nerve endings, which are direct attached to the this Merkel cells. Okay, and other sense like touch and pressure have encapsulated nerve endings. They are having the covering. So more pressure or more touch only you can sense. Okay, sometimes uh you sometimes you put your hand or anything, you can't able to sense those things. Why this happen? Because these nerves are encapsulated. Because of that reason, you are unable to sense the touch. Okay, no pressure is given, some pressure is given. Okay, so you will not able to feel that. Okay, the purpose of these receptors are sensation to provide the external nervous system with information about the external environment. I told that. Okay, this information may stimulate response such as washing a painful cut finger, scratching an insect bite, or responding to feeling of cold by putting on a sweater. Okay, the sensitivity of area of skin is determined by how many receptors are present. Okay, basically, uh, the sense how much fast and how much sense you are sensing, that it will depend upon how many touch receptors are there, how many receptors are present on that area. Okay, the skin of the fingertips, for example, is very sensitive to touch because there are many receptors per square inch. So basically, our fingertips have more receptors. So I think you can understanding that. So in the acupuncture or I think acupuncture also, we will insert needles here. Okay, to decrease the pain level. Okay, because there are more number of receptors are present here. Okay, and as well as if a BP shut out at for 180, above 180, 170, 180, 200, then you will release some amount of blood from here. Why are doing here? The scientific reason is here explained. So that's the reason I am telling you, please study physiology very carefully. Okay, every answer is in this subject only. Okay, so basically the fingertips have more number of receptors. Okay, that's the reason we can easily sense whatever things we can touch by this area. Okay, the skin of the upper arm with few touch receptors. Upper arm have, we have to, if we put one finger, you can do your means experiment. You touch here, you can easily feel the sense. You touch here. Okay, it will take time. Okay, some seconds have to be passed, then only you will feel the touch. Okay, when receptors detect changes, they generate nerve impulses that are carried to the brain, which interprets impulses as a particular sensation. Sensation, therefore, is actually a function of the brain. So basically, after that, what will happen? We study nervous system. So only glands means receptors are present. Okay, the receptors are called Merkels, which are two types of nerve ending we have. They are attached to the two types of nerve endings. What is free nerve ending? Second is encapsulated nerve endings. Free nerve endings will sense the pain and the heat and cold. because these are the important things which will take in very rapidly to the body when we have to protect ourselves. Next, we have touch and pressure. It will uh, sending by the message through the encapsulated nerve endings. So these are the things we have to remember. And fourth important thing is wherever the touch receptors are more, we have easy sensation, easy sense. Wherever the receptors are decrease, okay, per square unit, we will get less sense. Okay, these things we have to remember. Next, we will talk about glands. So basically, the glands are made up of epithelial tissue. So whoever secretes substance, those glands are made up of mostly epithelial tissue. The exocrine glands of the skin have their secretory portion in the dermis. So basically, the glands are present in dermis. Those glands are coming in exocrine gland. Okay, because they are not sending the substance into the blood in the plasma. They are subbing substance. They are sorry. They are sending the substance into the area. Okay, that's the reason we will call exocrine gland. We have sebaceous gland, and second we have caromeneous gland, and third have sweat gland, and fourth have eccrine glands. So we will talk about four glands today, and we will conclude our lecture. So basically, glands are made up. Talked about glands. So we have sebaceous gland. Sebaceous gland, the duct of sebaceous glands open into hair follicles or direct to the skin surface. This secretion is called sebum. So basically, this is the hair follicles. These are the sebaceous glands. So basically, these sebaceous glands will directly supply their sebaceous substance to the hair follicles. Lipid substance. What is that? It is lipid substance that we commonly refer as oil. So there's the reason some cases we have oily things we have. Okay, that is the sebaceous only. As mentioned previously, sebum inhibits the growth of bacteria to the skin surface. What will sebum do? It will decrease the increase of bacteria. Back, it will decrease the growth of bacteria. This is the main important function of sebaceous. Okay, and another function of sebum is to prevent drying of skin and hair. So it have to protect the skin and hair for drying. So it continuously produce sebum from for our healthy hair and skin. So here one question arises: if a patient have dry skin and dry hair, what is the reason? Easy answer, that is the sebum gland not working properly. So why this is happening? Because sebum gland needs oxygen and nutrition, means the reach of blood is not happening goodly. Okay, so we have to improve the circulation to the sebum gland, and we have to focus on our diet first thing. Then sebum glands will get the nutrition and it will work properly. Okay, the importance of this may not be readily apparent, but skin that is dry tends to track more easily. So, and the other side effect of dry skin is, and always dry. First thing, second thing, it will crack easily. We have in winter season we can observe that all our dead cells, all our skin have dryness, and it will crack easily because of sebum gland doesn't secretes sebum. Okay, or it will decrease the secretion in winter season, because in winter season we doesn't the temperature and humidity is very low. That is the reason sebum gland doesn't secrete sebum. Okay, very small breaks in the skins are potential enterways of bacteria. So if we have break skin, the bacteria will enterly easy and okay, easily enter. Decreased sebum protection is another consequence of getting older, and older people often have dry and more fragile skin. So that's the reason old people will have less amount of sebum. So that's the reason their skin are dry, okay, and always crack easily. Adolescents may have the problem of overactive sebaceous gland. Too much sebum may trap bacteria within hair follicles and create small infection, because sebaceous glands are more numerous around the nose and mouth. These are common sites of pimples in young people. So we will talk about common skin disorder. Okay, so basically, young peoples have, adults have their sebum glands were overworked because of their hormonal changes in the young age. It may be girl or boy after 18 years, in between 18 to 21, or below the 18 years, 16, 17, puberty age. Okay, their hormones work very rapidly. So that's the reason sebum gland secretes more sebum, and the sebum is on their face or on the nose, on the forehead, on the skin, on the hair. Okay, so that's the reason they develop pimples. So what they will do, they will able to put the creams, they will do facial, they will wash different types of hmm, different type of washers, whatever they will get. Okay, okay, face wash. Okay, they will use different types of creams which will give the least amount of okay result, and as well as their pimples may overgrow, and they have some side effects also. So basically we have to advise the patient, please doesn't use any type of creams. If you are maintaining our daily routine and diet and proper physical work, your endocrine glands very goodly. Okay. So next we have Cremineous glands. What does Cremineous gland do? It is also location at dermis. This secretion is called crumen. What it secretes? It will secrete crumen. It is in the ear. Okay, in the ear, it will protect the entering of whatever substance into the ear. Okay, cerumen keeps the outer surface of the eardrum palpable and prevents drying. Okay, we have to remember that. However, if excess cerumen accumulates in the ear canal, it may become impacted against the eardrum. This might damage the acuity of hearing by preventing the eardrum from vibrating properly. So basically, if the excess cerumen is uh, coming into our body, why this is happening? Because of any bacterial growth, whatever may be. So it will decrease our hearing. Okay. Next we have sweat gland. Sweat gland. What does sweat gland do? Sweat gland have two types of gland, that is apocrine glands and we have eccrine glands. First, we will talk about apocrine glands. Are most numerous in the axilla. These are the axilla region, genital region. Okay, it will release only activate in stressful condition, emotional condition. Although their secretion does have a order and have smell, so whoever have lot of skin in underarm, lot of lot of sweat in the underarm, lot of sin uh, in the genital area, it means that the patient is emotionally very stressful. Okay, this is the sign of the emotional condition. Okay, if anyone have this condition, you can observe and ask the patient. Okay. Animals such as dogs, however, can easily distinguish among people because of their individual sins. If the apocrine secretions are allowed to accumulate to the skin, bacterial metabolize the chemicals in the sweat and produce waste products that have distinct odor that may people find unpleasant. Why this is happening? Because whenever the sweat glands release the sweat, okay, this area is not having that much exposure to the outer environment and as well as genital area. Okay, so that's the reason some type of bacteria will sat on that area. Whenever the sweat glands and the bacteria mix together, they produce odor, bad odor. Okay, this is the reason. Next, we will talk about eccrine glands. Eccrine glands are found all over the body, but especially numerous in the forehead, upper limb, palms, and soles. Eccrine glands are present in forehead, upper lip, palms, okay, and as well as sole. Okay, the secretory portion of this gall is simply a coil tube in the dermis. The duct of this tube extends and the skin surface very tube in the pore. And these eccrine glands have pores on the skins. Okay, whatever pores we are seeing, these are the eccrine gland pores. Okay, the sweat glands produced by eccrine glands is important to maintain of normal body temperature. So the sweat glands, they produce the sweat because of maintaining body temperature. In warm environment or during exercise, more sweat is secreted into the skin surface. So in the uh, means in the what we call warm environment or exercise, whenever we do, we will get more uh, sweat because of our evaporating excess heat from the body. Recall that water has have high heat of vaporization, which means that a great deal of heat can be lost in the evaporation of the related small amount of water. Although this is very effective mechanism of heat loss. So basically, the sweat glands will decrease the heat from the body. So that's the reason we have to do exercise. We have to do lot of exercise, or we have to expose to the some of the warm environment also. Although this is very effective mechanism of heat loss, it has potential serious disadvantages also, because if lot of sweat expose or expose from our body, what will happen? Dehydration will happen. In the warm environment, we'll get sweat and we will have thirst. Okay, we'll have thirst. Basically, why this is happening? Because sweat glands secreting the sweat from the body, so we are getting thirst. Okay. Those who exercise regularly know that they must replace salt as water. So whenever we have to lot of sweat, means some amount of sodium is also going from out our body. So we have to maintain the sodium levels also in our body. Sodium chloride is also lost in water, or a small amount of urea. Urea also losing from our body, means the waste products also losing from the body. Okay, this excretive function of the skin is very minor. However, the kidneys are primarily responsible for removing waste products from the blood and for maintaining the body's proper salt to water proportion. So basically, the kidney will release the urea from the body. So basically, here we have the sweat gland is very important. We have apocrine glands, eccrine glands. Eccrine glands will release sweat all over from the body, mainly during warm environment or physical work, or but apocrine glands work only in emotional condition. Okay, whenever you have emotional condition, please remember that you have lot of sweat in your underarm, in genital area. Okay, so please remember all those things, very important. How to ask the question, okay, to the patients, when you have to, when you remember it. Okay, so we conclude our class here. Tomorrow we'll talk about blood vessels what are present in the and subcutaneous tissue. Okay, thank you.